According to a study published by the International Diabetes Foundation, an estimated 12.5 to 14.5% of the population in Trinidad and Tobago is afflicted with diabetes. The vast majority of cases, an estimated 88 to 90%, are type 2 diabetes. There is a growing concern among health professionals that type 2 diabetes is increasingly being diagnosed in children, adolescents, and young adults. For many persons with diabetes, managing the condition is already demanding, but balancing it with daily workplace responsibilities adds another layer of stress.
It is a very big concern with employees, living with diabetes and having to come to work on a daily basis. The worry or the stress of your diabetes sends up your cortisol levels, and that in turn sends up your sugar, and that in turn sends up your cortisol level. So it's a cycle that feeds itself.
Health professionals and diabetes advocates believe employers can make meaningful adjustments that support both well-being and productivity for persons with diabetes.
There's a lot of different things employers could do to help with diabetics in their workplace. One, having a private setting for them to take their medication. Some persons need to inject with insulin. Having available spaces for that to happen.
These workplace accommodations are even more essential in emergency situations.
But there are still workplaces without sick bays, and sometimes if a person goes hypo or hyper, that's a high or low, then they need to have this accommodation. Okay? They need to be stabilized until the ambulance system is there.
Beyond the physical adjustments, effective diabetes management requires more than medication and nutrition. Holistic approaches and therapy can help both mental and physical health.
So obviously one is proper diet, getting exercise, but in addition to that, and taking your medication of course, and in addition to that, we add the psychological aspect, the mental well-being aspect, the mindfulness, things like yoga, things like breathing techniques, going to see therapy, going to see a counselor.
Employers can also encourage healthier lifestyles by starting with simple changes like improving food choices and ongoing education for staff and management.
All right, we could offer more healthier options. We could offer fruits, we could offer vegetables, simple as a salad, along with meals. Most companies, the cafeteria, may not offer a healthy salad along with the meal. So we want to bring balance, all right? So that's the first step we could take. Education is always key, right? The key to it is education.
With diabetes affecting tens of thousands of working adults in Trinidad and Tobago, advocates believe workplace support must ensure that employees are protected, accommodated, and empowered to manage their health.